Namaste, I am Dr. Amit Mishra, radiologist, Perfect Imaging. And today we'll talk about another very common gallbladder disease which a lot of you, or at least some of you, have been suffering from, and you have probably you have seen in your ultrasound report. I'm talking about gallbladder polyps. So gallbladder polyps are very common, and they are frequently diagnosed on abdominal ultrasound. So some of the patients get really stressed out as what to do next and how dangerous can these polyps be and whether they need to be scared or not. So I want to explain about gallbladder polyps because there is a lot of misconception about gallbladder polyps. So what is a gallbladder polyp? So polyp is a very small tiny structure which can be attached to your gallbladder, the walls of the gallbladder. A tiny structure can be seen on ultrasound which we call as polyp. So what is the risk of this polyp? So polyp, whenever you are diagnosed with polyp, you need to remember there can be risky polyps and there can be non-risky polyps which do not have any significant importance. So non-risky polyps include those polyps which are small in size, 6 mm or less, which do not have any blood vessels, any vascularity on ultrasound, which are generally more than 1 in number, and which do not have any risky features. Risky features include a broad neck or associated gallbladder wall thickening along with the polyp. So these are some of the risky features. If you do not have these risky features, then if the polyp is small in size, less than 6 mm, and there is no vascularity, there is no blood vessels associated with it, then this is a non-risky polyp and you do not need to be too much scared, or you do not need to be stressed out about this polyp, and you can just carry out interval ultrasounds like in 6 months or so, and you can just see how this polyp is behaving. On the other hand, if you have a risky polyp will be called, which is a big polyp, 10 mm or more in size, which is usually single in number, which has some of risky features associated with it, like a broad neck, like gallbladder wall thickening adjacent to this polyp. So if you have these kind of features on ultrasound, you can discuss this with your radiologist whether this polyp is whether your polyp is risky or not, and if it is a risky polyp, the features which I just mentioned. So in that case, then you need to be a little bit more conscious about it, and you need to do repeat ultrasounds in quicker intervals, let's say 4 months or 3 months, or you can go for a surgery. So if there is a risky polyp which has high risks, then you can opt for a surgery, or you can be under very close observation. So let's say 2 months, 3 months or 4 months, and you can very closely observe the behavior of that polyp, or you can opt for a surgery. So in that case, surgery will be indicated. So this is about the risky and non-risky polyp which you should know, because not all polyps are risky. In fact, most of the polyps are small in size, and most of the polyps do not pose any significant risk to the patient. However, as I said, some polyps can be of risky nature, and in those polyps you need to be either under very close observation, or you can opt for a surgery. So this is what I wanted to explain about gallbladder polyps, which is a very common condition and lots of patients are suffering from it. Thank you.